Hello, and welcome once again to the Dental Marketing Mastery Series. This podcast is brought to you by New Patients Incorporated and NPIClick.com. I'm Howie Horrocks, the founder of New Patients Incorporated. Along with me once again is my friend and partner and the president of New Patients Incorporated, Marv Dilatush.
Hello, everybody. Welcome to our podcast and the Dental Marketing Mastery Series. Normally, you would be hearing the soft, sultry tones of Howie Horrocks' voice as the intro. You don't get that today. It's my raspy voice from New Jersey. We have a special guest today. His name is Dr. Marvin Berlin. Doc, say hi.
Mark, how you doing today? Thanks for having me on the podcast. Looking forward to it.
Good. Dr. Berlin helps dentists solve a problem that New Patients Incorporated cannot solve. Dr. Berlin, and we're going to get into this a little bit later in the podcast, helps dentists squeeze ROI from their marketing dollars in ways that we can't. And from a marketing company standpoint, if you know anything about us, you know everything we do is data-driven. And as we accumulate data from client offices, we're match and compare that to other offices. And when we see folks who are getting the patient's volume, getting the quality, interaction with the patient, and their ROI isn't building as fast as it normally would, then we grow concerned. And we chase it down because we understand dentistry. And then many times we get to the point where the new patient exam, what's going on? What's the interaction? What does the patient see? What does the patient not see? And Dr. Berlin really is actually very passionate about teaching dentists how to use photography. So that's the subject of this podcast is using your photography to get necessary treatment done by patients, obviously. And he's going to teach us, or at least give us an intro on what he does.
Absolutely. That was the perfect introduction. And I'm excited about it because I see so many dentists that are getting good at marketing and getting patients in the door, and then their patients are just treading water and not moving forward. And a lot of it has to do with photography. It's one of the, it's a spoke in the wheel. It's obviously a big wheel with a lot of spokes, but photography, we have a very large practice, a very productive, profitable practice. And one of the keys, if not the biggest keys of our new patient exam and getting patients to convert is co-diagnosis with them and just sharing with them their own pictures of their teeth. And so many dentists don't do this. And so that's how this passion of mine started. I've been teaching photography for 15 years and in some way, shape, or form. And I've finally decided to take it online and help docs get over this. Either if they have a camera, let me show you how to use it, just the basics. And if you don't, let me show you where to get one, how to use it, and then more importantly, how to implement it in their practice.
Yeah, how to delegate it, right?
So that's the main thing. That's the main thing. This is not I want to teach you how to take pictures of pretty lips and sparkly teeth. And right. This is not what I do. I just don't. That's cool. I can teach you that if that's something you want to learn. And it's another whole course. But what I'm really passionate about is just getting docs to have better case acceptance with the patients they have. And I'll tell you a story, Mark, that where this started with me. I've been in dentistry for 31 years. Right when I got out of school back in 89, my very first continuing education class that I went to was this guy, an amazing dentist out of Canada, Bud Sipko. And we actually became friends, and I actually became a patient of his. I just so was enthralled with the way his passion about dentistry. And this is, me right out of dental school. So I didn't know, I knew how to not hurt someone, kind of.
You were a greenhorn.
I was so green, it was scary. Right. And all of a sudden, I'm seeing this guy who's like, has a beautiful practice, and he's just talking my language, like, hey, really, let's take care of patients. Anyway, I go up there and we have this exam, and he's like, well, we'll do your new patient exam. You'll need to be here for a couple of days. I'm like, oh, I didn't even really get what he was talking about. So we sit down for the exam like on a Monday, and he does this crazy thing. He pulls out this big honking camera and he's taking pictures of my teeth. I'm like, what the heck is this thing? And then he said, well, we'll review your findings in 3 or 4 days. I'm like, what? And because it meant so much to him, this was back in the day where, we didn't have digital photography. He literally would have to take the 35 millimeter roll of film to Wolf camera, get it developed 2 or 3 days later. And he did all of his new patient exams that way. Everyone was a 2-step process. And I remember him bringing me back and he sits down and he hands me this like portfolio. Right. He says, Marvin, take a look. What do you see? And I look down and I'm like, well, what do you mean? And I'm looking at it like, holy crap, that's my teeth. I'm a dentist, yet I'd never seen my own teeth. And I'm looking at these mercury fillings and cracks. I'm like, holy cow, it hit me. I was like, I have to do this. This is the way. There's no other better way to show patients what's going on in their mouth than just show them. And the reality is, and it took me a while. I went through trying some cheaper cameras and point and shoots and this, that, and the other. Right. And eventually just had to break down and say, you know what, I got to get the right equipment. I got to learn how to use it. And then on top of learning how to use it, I've got to delegate and create systems to where it gets used on every patient. And so that's how it's kind of evolved, and where now every patient, I think we have 5 or 6 cameras in our office just because every hygienist has one. We're just always using them because we have a lot of new patients and a lot of patients in general. But that's how it started. And so I've kind of taken that and run with it. And I'm just wanting to share it online, and so that anybody can have access to this.
Yeah, I want to let everybody know, back when you owned, when all the partners owned the practice, we did a bunch of marketing for you. And then,
oh yeah, huge.
But I know, but what I really want to say is this is an 8-figure a year dental practice. They skipped right through 7 figures. So, and it's one location, right, Marv?
Yeah,
Still
one location.
Yeah,
one location. We're 7 figures a month, but
right
with 4, so we get after it. And
yeah, so my point to my list. I'm sorry, my point to my listeners is you guys probably go to seminars time and time again with speakers who don't walk the walk. I'll be the first one to tell you this guy walks the walk. Okay, he's sharing with you part of that journey, so pay attention. I'm sorry. Go ahead, Marv. So what is it? How do you teach people? You teach people.
Yeah, man, thanks for asking. Great question. And it's kind of evolved like the rest of the online process has gone. We've all gone to, and there's photography classes you can go to at meetings and whatever. But the reality is, and I think this is going to change education in general, is it's online. And so what I've done is I've created a full podcast or webinar, if you will. We're going to launch it on December 10th. It's dentalpix.com, PICS, dentalpix.com. You can sign up. And it's an hour and a half podcast where I'm going to take everybody who wants to know photography and walk them through step by step what to get, what equipment to use, how to use it. We're going to walk through the basics of photography, what buttons to press, what buttons you don't need to worry about, what are your basic settings, all the settings you need, which are basic really, and then just walk everyone through the podcast where how to do this. And that's my goal, is that the very next day out of this webinar is that you are taking pictures in your practice. I'm going to show you how to get the camera, where to get it. I've researched the heck out of this, and just going to walk them through that. And really I think there's 2 different clientele. There's docs that don't have a camera, know they need it, and they just don't have it on their radar. And I'm just telling you, you do. And then there's docs that have them and have kind of put them on the back burner because they maybe didn't learn how to use them, or maybe they just got busy. They don't really have a system in place that allows them to use it. So we've created, and I'm going to share with you, everybody in the webinar, exactly how we do it, how we set it up. We've created a position in our office called the hygiene quarterback, whose job is to bring every patient in. They get, before anybody sees them, they get their photos taken. And then while they're getting their x-rays done, the pictures are uploaded. We kind of walk them through that process and how it's a minimal time, but maximum productivity part of our new patient flow. And it just builds and builds and builds. I mean, I can't, my team knows they're not even going to ask me to come into a room unless the pictures are not only taken, but taken endodontrics up on the computer in their proper position. We encourage them to put it in a certain way that patients can see. And we've got it, Mark, we've got it down to where when you're looking at a picture of yourself, we've got it flipped to where it looks like it's a mirror image of yourself. So your upper right looks like the upper right there. So you don't have to go, oh, wait, where does that, my mouth? We take the time to just, and it's a click of a button. But if you don't do it, there's a little bit of disconnect. If you're looking at the right side and the patient's feeling on the left, they're like, what the heck's going on? It's just like with x-rays. And so we quit diagnosing with x-rays. We just show them. And I do the same thing that doctor did to me 30 years ago. We put them up on the screen and I just go, Miss Jones, what do you see here? And I just shut up and let them just digest it. And 90% of the time they go, wait, is that my teeth? I mean, they've never seen it, and they're like, yeah, those actually are. And so, but it starts that conversation. And then there's some built-in trust that happens right off the bat in that, hey, we're looking at the same thing. And anybody can look at a mercury filling and anybody can see a crack and anybody can see an open margin. I mean, if it's there, I mean, you can just see it. There it is. And so it just starts the whole co-diagnosis process with our patients, and just the case acceptance just goes in so much more of a positive direction than without it. And so that's our whole premise right there, is just better case acceptance. When
you and I discussed this at the very beginning, we were talking about the two things that you have to do in marketing. The first two things you have to do in marketing a dental practice is these are to non-patients, is to establish some elevated level of trust and respect in the audience. Now, there's a million ways to do that, but that's really the first two things you have to do. Because if people don't trust you and respect you, I don't care who you are. It doesn't matter. Right. Okay. So if your advertising and your marketing gets those people to be a little bit elevated and make their first phone call, that's the first leap of faith. Now they're laying down in their initial exam chair. This is a whole other level of leap of faith. Okay. So now, right, what you're saying is that you take that leap of faith quotient from a 3 to a 9 on a scale of 1 to 10. Because if they're a 3 and they're sitting in my chair, we got them there. Now we get them up to 9. What you're saying is this whole process, which doesn't sound interruptive. It doesn't sound like something a dental practice can't do. It sounds, actually, I'm not going to say simple, but I'm going to say doable. Right?
It really is.
It just takes that level of trust and respect up to 9, basically in the same amount of time you were going to be with the patient anyway.
It really is.
You're just letting them do the talking.
And I even say, and there's some, we could get deep into this, but there's some science into this where the amount of time it takes me to explain what's going on versus the amount of the time that it takes for me to point to a screen and say, look what's going on. And I'm telling you what, the time it takes to take those pictures and upload them
exactly
is infinitely smaller than the time it would take me to explain everything that they show you. And so the timing of the math works out so much better in our favor in minimizing the exam process, because there's a crack, period. You just can't miss it. That's going to get bad, and let's fix it. And so that's the premise around this. There's a lot of docs that go, I don't need it. I'm good at explaining, and I can do it with x-rays. And I've heard every excuse. But the reality is, 99% of your population have not seen their teeth and will make better decisions when they do. There's 1 or 2% that go, oh, I don't want to see this. No, just, and that's cool. You're going to get those, and that's okay. But the other 98 or 99% of them get it and make better decisions because of it.
How many of those 1 or 2% that don't want to look are guys?
100% of them.
I know.
No, guys our guy patients are the biggest weenies.
I know.
There's no doubt.
I know. That's why
they really are.
That's why I asked.
Yeah, they sure are.
So
it's crazy.
So as we walk through this, so we have a new patient. They come in. They go through this process. You've delegated this process, so you've basically taken it down to a whiteboard, operational steps, what the person does when they do it, what you expect as the dentist to see on the screen when you walk into the operatory. You've got it boiled down to el dente, right? You got everything should be laid out, right?
And and that's what we're going to go over in the webinar too, because I'm going to show you, hey, these are the 10 pictures we take. Here's why we take them. Here's how you take them. Here's where the patient sits. We're just going to walk right through it. And I'm going to make it as simple as I possibly can so that anybody watching that can incorporate it. And then where there's no excuse. I mean, it's just a matter of just a dentist deciding, hey, this is how we're going to go from here forward. Here's how we're going to do it. By the way, Susie assistant, here's the picture of the picture I want. Make it look like that. Here's where you stand. Here's where the patient sits. Here's the buttons on the camera to press go, and do that 10 times. And then here's how we're going to upload it. And it just becomes about a 7-minute process, to be real honest with you. And that, as I said, that 7 minutes will definitely make it up on the other end when you don't have to explain so much during the exam.
Yeah, well, there's a whole bunch of makeup on the back end from the admin standpoint too, because the greater your treatment plan acceptance, the lower your back end administrative cost. So it's going to cost way more than 7 minutes on the back end to try and get.
Yeah, and also you're getting your medical legal considerations. Now you've got documentation of what they look like. You're going to get better insurance reimbursement. You've got, art for your office. You've got, if you're case planning and need to do a smile design, you can go back and look at it. You can better lab communication. I mean, I've got a list a mile long of what all else it does. I'm just kind of showing you the tip of the iceberg of the case acceptance. But when you start getting your afters, your before and afters, and then you start creating a portfolio of your work, using that portfolio online, I mean, then it becomes exponentially important because you're not only, doing case acceptance for new patients, you're doing, 20 unit veneer cases, and now you're posting online. And so we're obviously scratching the surface here, but you've got to start somewhere. And I think it's so important.
So this is the starting point. Right. Dental picks and this webinar. When is the webinar?
Well, it's December 10th, 6:00 Central Time. Okay. And it's dentalpicks.com. It's a free webinar. Sign up and we'll have a good time. We'll have Q&A. It's wide open. You can ask me anything. If you have a camera or you want me to ask a question about it, I pretty much know every button on these cameras, so I can help you out there. I mean, I'm here for you guys, and just wanted to share it with big fan of MPI for, goodness gracious, 20 something years. So would love to help you guys out. And
that's why we're sharing it with our tribe.
Yeah,
right. We have a pretty good following, and we'll put it up on because what you're doing, Marv, is indirectly helping our clients. Maybe go from a 4-to-1 or a 5-to-1 first year to an 8 or 9-to-1 ROI the first year, right?
It's just,
if you end up having more cases, then it's just math. At that point,
the math is really good. In
exactly.
Your favor. Yes, sir. It is. It really is. Well,
all right. So dentalpics.com, dentalpics.com. You can just go there, log in, sign up. It's sign up for December 10th at 6 p.m. Central Standard Time.
That'll do it.
And what would you say, Marv? The dentist and the person they think they're going to delegate this to? Like, who should be in the audience on December 10th at 6
On the December 10th, for sure, the dentist. I think the team member might come better at a later date. But it's definitely open to team members. It's not just for dentists. But my message is going to be for dentists to learn this and then get that camera out of their hand and put the handpiece in their hand. And because that's how we're most productive. We're not productive with the camera in our hand. But I got to teach them how to use it, because there's going to come a day when all of a sudden all the pictures are dark and you're like, what the heck's going on? And I'm going to walk you through. Here's how we fix that. It's a quick little fix. And so there's little tips and tricks we're going to go over as well. But again, my goal here is for docs to learn it and then delegate it. They're welcome to bring as many people as they want. It's like I said, it's free webinar, so just welcome anybody. And I just guarantee you'll get something out of it. And because that's my goal. I just want you the very next day to go, okay, we're starting taking pictures, period.
Good.
There's no downside. No downside.
Well, Marv, I thank you for introducing this to our clients and our non-client, whoever's in our audience. We have a mix of both.
You're more than welcome, guys.
Yeah, this will help. This will definitely help people. None of this surprises me. I've watched you for the last 25 years be a pioneer in so many different areas in dentistry, and a lot of props coming your way, pal. Even though you're a Cowboys fan, see, that's really hard for an Eagles fan to say. I just want to impress upon you how difficult that was. I had to, right?
Yeah, I knew it was coming.
Seriously, Dr. Berlin, thank you very much, and I hope everybody that's listening to this will go there and take part in this free education on December 10th at 6 p.m. And might as well. It's a free webinar. The worst thing that's going to happen is you learn. That's it.
That's it. So that sounds good.
All right, Marv. Thank you.
All right, man. Hey, Mark. Thank you very much. You have a good one. Appreciate it.
You too.
Bye-bye.
Bye-bye.
We hope you've enjoyed our podcast today. You can get all our podcasts on iTunes, Stitcher, and Libsyn.com, and on our websites newpatientsinc.com and npiclick.com.